Hi, this is Dr. Anderson from Anderson Center for Chronic Pain and Neuropathy, and I'm here with Sarah today. And what we're going to show you is ultrasound of her a nerve tunnel. It's called the superficial peroneal nerve. It's in the lower third of your leg. We all have the nerve. We all have the nerve tunnel. And the anatomy of the nerve tunnel can vary. It can be a little bit high in the leg, it can be a little bit low in the leg. And we sometimes have to open up that nerve tunnel to reverse neuropathy, and really common, especially with restless leg syndrome. So what we've been noticing recently is the shape of the nerve changes. When it's high in the leg, it's kind of nice and kind of more oval shaped, but as it comes down, it's getting closer to a layer called the fascia, and it goes from being underneath the fascia, which is kind of like gristly tissue, to being on the outside of the fascia, because its function is to supply the top of the foot. It supplies the skin. So as it's traveling from up by the knee, coming down, coming down, coming down, again, you're going to see, hopefully we'll see on this ultrasound, the shape changes as it gets closer to this fascia, and it flattens the nerve. It shows it, usually we can see it, and that's evidence that the nerve is being irritated by the fascia. It's a sign that the nerve is kind of being squished or pinched, if you will. So anyway, this is Sarah. We'll introduce her.
Hi.
So thank you for volunteering. And so if we can, when we do this, I'm probably going to have you, we'll have you kind of come over here a little bit closer, and we'll find it. And actually, right there's the nerve, right kind of at 12 o'clock. Maybe get up even closer if you need to, Josh, so you can really see it. So this is skin, and then this line right there, this is a side-to-side view, and so there's the nerve up higher in the leg, and I'm actually going to freeze this for a second, and so we're going to freeze it, and I'm going to mark it on the leg, and so about right there is where we marked it, and we're going to do a measurement. So and we'll write this down, that's about 12 centimeters up from the ankle, and 12 centimeters up, and the measurement there is going to be so the width here that comes out to about 3.2. Okay, so that's 3.2 side to side. Okay, so I'm going to write that down. So that's in millimeters. And then we're going to take this again, and we're going to come down a little bit further and see how much the shape of this nerve changes. So there it is again, and let's see, and you can see it's starting to flatten, and you really see it there. So it's quite a bit flatter. That's a pretty good picture. So there, and so that is a little bit lower. And the measurement of that's going to be, so the first measurement is 3.2 millimeters wide, and the width here, there's the nerve. We're going to go over to about here, and we're almost at 4.9, maybe even 5. Okay, so we'll just say 4.9. So it went from, again, being kind of round to flattening as it's coming down the leg. And you're probably wondering, well, what's the big deal about that, Dr. Anderson? Well, the big deal is it shows that it's a way to show physically that there's compression on the nerve. And we do this on other nerves in different ways that we measure, but not only can we tell from our examination that we have for patients, but we can also tell from just looking at the ultrasound. So you're physically seeing it. So anyway, hopefully that made some sense. And there's no studies on this yet. Hopefully there will be someday, but we're actually showing the difference between the nerve where it's being compressed and where it isn't. So anyway, we want to thank Sarah for doing this. And hopefully that was educational. Again, it's showing you that are watching that the nerve is actually being compressed in that area. So thank you for watching. If you have any comments or things you'd like me to go over, let me know. And as always, click on the subscribe button. We'd like you to join our community of people that want to know a lot more about nerves. So thank you for watching.